5 indicators an elderly individual may be in their final year. Subtle signs you shouldn't overlook. Have a loved one started exhibiting subtle yet worrisome changes over the past year? Many assume that passing in old age happens abruptly, but the reality is the body often gives off quiet warnings months or even a year before life comes to an end. The challenge is that most people overlook these signs because they appear minor initially. It's only when looking back that families realize the hints were there. But by then, it's too late to prepare or to create meaningful final memories. In today's discussion, we'll explore 5 critical indicators that often emerge a year before an elderly person passes. Some may be things you've noticed but dismissed as typical aging. Others might seem like small changes but actually point to the body's gradual decline. Identifying these signs early allows you to provide better care, treasure meaningful moments, and most importantly, ensure that your loved one's final chapter is filled with comfort, dignity, and peace. Stay with us through the end, because these 5 signs can emotionally and practically help you prepare for what lies ahead. When you comprehend what's happening, you won't be taken by surprise. You'll be ready to make the most of the precious time left with those you care about. Let's dive in. Number 1, noticeable weight loss. One of the first and most revealing signs that someone may be nearing their final year is unintended weight loss. At first, it might appear minor, a belt that suddenly fits tighter, clothes that hang looser, or a once hearty appetite that begins to decline. Many families brush it off as a normal part of aging, but the reality is that losing weight without trying is rarely a positive sign. It typically suggests that the body isn't absorbing nutrients properly, muscle mass is diminishing, and critical systems are slowing. While some muscle loss is a natural part of aging, rapid loss often signals something more significant. The body may struggle to digest food efficiently, or protein metabolism may falter, resulting in muscle wasting. This decrease in strength doesn't just impact mobility. It also raises the risk of falls, weakens the immune system, and leaves the individual more prone to infections. Another contributing factor is changes in appetite. Many elderly individuals no longer feel hunger as they once did. Their sense of taste diminishes, food loses its appeal, and they may start skipping meals or eating much smaller portions. This isn't simply personal preference. It's a physiological shift. As the body begins to shut down, it stops sending strong hunger signals to the brain. Additionally, underlying medical conditions often play a role. Chronic illnesses like cancer, heart failure, or kidney disease frequently cause early weight loss, sometimes long before other symptoms emerge. Even mental health conditions like depression or cognitive decline can reduce food intake. Some families attempt to counteract this by offering favorite dishes or using protein supplements. However, if weight continues to decline despite these efforts, it's crucial to understand the problem isn't just dietary. It's the body's preparation for a deeper transition. At this stage, encouraging large meals may not be effective. Instead, focusing on comfort, offering easy-to-eat foods, and ensuring hydration can make a greater difference in preserving quality of life. If you observe significant weight loss in an elderly loved one, especially if they're eating less, feeling weaker, or struggling to remain active, it's a signal to pay close attention. This is more than a physical change. It's the body trying to communicate. Recognizing this early can help you approach the road ahead with compassion, clarity, and the ability to make every remaining moment truly meaningful. Number 2, severe fatigue and weakness. One of the most evident changes leading up to the final year of life is overwhelming and persistent tiredness that doesn't improve with rest. It's not just occasional weariness after a busy day. It's a deep exhaustion that makes even basic activities feel daunting. Getting out of bed turns into a struggle. Walking a few steps across the room requires notable effort. Everyday activities like preparing a meal, getting dressed, or even maintaining a conversation can become draining. This isn't merely aging. It's the body actively conserving energy. As internal organs begin to function less efficiently, the body shifts to focus on essential survival needs. The heart pumps less powerfully, circulation decreases, and muscles don't receive as much oxygen. A major contributor to this exhaustion is metabolic slowdown. Rather than using energy to fuel movement, the body reallocates its energy toward basic preservation. That's why individuals nearing the end often sleep more, need more frequent naps, and find it difficult to stay awake for extended periods. There may even be sudden, noticeable drops in energy, moments when they seem fine, then rapidly become completely drained. One of the most heartbreaking aspects is how this fatigue affects emotions. Seniors who once prided themselves on their independence may start to feel frustrated, embarrassed, or defeated because they can no longer manage tasks they once handled with ease. They might retreat from conversations, skip social gatherings, and stop participating in hobbies, not due to disinterest but sheer lack of energy. This retreat can lead to isolation, which only hastens the overall decline. For families, watching a once vibrant loved one become exhausted and withdrawn is deeply painful. It's tempting to encourage them to be more active, thinking it might help. But forcing activity can do more harm than good. What matters is recognizing their new limits, offering them space to rest, and ensuring their remaining time is as comfortable as possible. If you notice deep, ongoing fatigue that no amount of sleep seems to cure, recognize it as a sign of the body's transition. This is the time to focus on meaningful conversations, gentle support, and creating peaceful, pressure-free moments. Because in these final stages, the most important thing isn't how much they accomplish, but that they feel cared for, understood, and loved. Number 3, increased cognitive confusion or withdrawal. As an elderly person approaches their final stage of life, one of the most striking transformations can be seen in how they think, communicate, and connect with others. You might notice someone who was once sharp and engaged begin forgetting simple things more often, struggle to keep up with conversations, or appear disoriented even in familiar surroundings. They might repeat themselves, forget names, or lose track of dates and times, even if they previously had no memory issues. These cognitive changes can emerge months or even a year before passing. This is more than normal forgetfulness. The brain, like any other organ, depends on a steady supply of oxygen and nutrients. As circulation diminishes, brain function also declines. You might see them becoming confused more easily, facing challenges making decisions, or having difficulty recognizing long-known people or places. In some instances, they might have brief moments of mental clarity followed by sudden episodes of confusion, almost like their mind is flickering in and out. Another sign to watch for is emotional withdrawal. Someone nearing the end of life often pulls away socially. They may talk less, engage less, or spend long hours sitting quietly, seemingly detached from the world around them. It's not because they have stopped caring. Their brain simply processes emotions and social interaction differently now. Conversations become exhausting, loud environments feel overwhelming, and eventually, they may retreat inward. You may also notice mood swings and behavior changes. Some individuals become irritable, anxious, or easily upset, while others grow unusually calm, detached, or indifferent to things they once loved. These aren't personality changes by choice. They reflect the brain adjusting to the body's decline. For family members, witnessing a loved one withdraw mentally and emotionally can feel like grieving before they're truly gone. It's crucial to understand that they can't control these changes. Rather than trying to pull them back into long conversations, it's better to meet them where they are, speaking softly, offering gentle reassurances, and maintaining a comforting presence. If you notice growing confusion, forgetfulness, or emotional withdrawal, don't ignore it. These are often signs that the body and mind are preparing for the final transition. Now is the time to practice patience, treasure the quiet moments, and build an environment that feels safe, familiar, and soothing. Because even when memory fades, the warmth of love and care remains deeply felt. Number 4, frequent infections and slower healing. As the body nears the end of life, a weakened immune system becomes one of the clearest physical signs. You might observe that someone who rarely got sick in the past now seems to catch every cold, every flu, and every minor infection. Small illnesses that once passed quickly now linger for extended periods. Simple wounds like cuts or bruises take noticeably longer to heal. These aren't random changes. They're signs that the body can no longer defend and repair itself as it once could. Repeated infections become a major concern. Issues like pneumonia, urinary tract infections, UTIs, skin infections, and even mouth infections tend to occur more frequently. Many families initially view these as isolated illnesses. But when infections happen more often or don't heal properly, it's often a sign the body is losing its resilience. Antibiotics that once worked swiftly may now have little effect, requiring stronger medications, longer treatments, or multiple courses of therapy just to manage what used to be minor health issues. One more often overlooked problem is chronic wounds. If you notice that even small scrapes or sores don't heal properly or seem to reopen, it could be a warning that circulation is compromised. Poor blood flow deprives tissues of oxygen and nutrients, making healing slow and incomplete. Pressure sores, especially among those who are less mobile, also become a serious risk and can lead to dangerous infections if not closely managed. Worse still, infections in the elderly don't always present with classic symptoms. Instead of a high fever, an infection might show up as confusion, increased sleepiness, or a loss of appetite. In fact, a sudden decline in mental alertness is often one of the earliest signs of infection in seniors. Recognizing these signs early can significantly impact how much comfort and support you can offer during the final stages. For families, it's heartbreaking and frustrating to see a loved one battling repeated infections. It's tempting to pursue aggressive treatments, hoping for a cure. But eventually, the focus often shifts from curing to comforting, prioritizing hydration, keeping the skin clean and moisturized, and reducing stress. Sometimes, providing comfort offers more peace than another round of hospital visits or antibiotics. Number 5. Major changes in breathing or circulation. One of the clearest signs that the body is approaching its final phase is a noticeable change in breathing and circulation. You might observe that your loved one breathes more slowly or shallowly than before. Breathing may become irregular, speeding up and slowing down unexpectedly, or they might take longer pauses between breaths. Some individuals develop a pattern called Cheyne-Stokes respiration, alternating between deep, rapid breaths and long pauses. At first, these changes might be subtle, but over time, they grow more pronounced. You may also notice weakened circulation. Hands, feet, nose, and ears may feel cold to the touch. The skin may turn pale, bluish, or mottled, particularly around the extremities. This happens because the body prioritizes blood flow to vital organs, reducing circulation elsewhere. Shortness of breath becomes more common, even with very little activity. Simple actions like sitting up, talking, or shifting position can leave them feeling breathless. You might see them breathing through their mouth more often, or needing frequent pauses mid-sentence to catch their breath. If they once walked across the room easily, but now struggle, it may be a sign their lungs and heart are weakening. Fluid buildup in the lungs can also make breathing harder. This may cause coughing, gurgling sounds, or a feeling of chest tightness. While it might resemble a common cold, in the elderly nearing the end, it's usually a sign of lung decline. Sleeping flat might become uncomfortable. Many prefer to sleep propped up on pillows or in a recliner to breathe easier. For family members, these changes can be alarming. It's natural to want to help, to encourage deeper breathing, or to panic at what feels like an emergency. But often, this is simply the body's natural way of winding down. While there might not always be a way to reverse these symptoms, you can help by focusing on comfort, keeping the room cool, using a humidifier, offering sips of water, and sometimes using medications or oxygen therapy to ease discomfort. If you notice signs like irregular breathing, cold extremities, or a bluish tint to the skin, understand that the body is conserving energy and slowing circulation. Now is the time to create a peaceful environment where they feel secure, loved, and calm. Final thoughts. As we wrap up this discussion, take a moment to reflect on the 5 major signs: noticeable weight loss, severe fatigue, cognitive changes, frequent infections, and major breathing or circulation changes. These signs don't usually appear all at once, nor are they always obvious initially. But when you begin to see them, it often indicates that the body is preparing for its final journey. For families, these transformations are difficult to face. It's natural to want to fight against them, to encourage more eating, more activity, more engagement. But sometimes the most compassionate response is to listen to what the body is saying. Instead of trying to reverse the inevitable, focus on making the time that remains peaceful, meaningful, and full of dignity. Recognizing these signs isn't about fearing death, it's about being ready. When you know what to expect, you can offer better support, make thoughtful decisions, and ensure that your loved one's final months are filled with love and comfort. This is a time for sharing stories, cherishing small moments, and letting them know they are deeply valued and never alone. If you're seeing these signs in someone close to you, take a deep breath and remember, you are not alone. Many families have walked this path before you, and although it's never easy, understanding what's happening can help you find strength, patience, and peace. Thank you for being here with us today. Please share one thing you learned and how you plan to use it. We'd love to hear your reflections. Your thoughts motivate and inspire us. We look forward to seeing you again in the next video.